Thanks for joining us, Stephen. Keen to hear about that South Australian-Victorian border. As we all know, a lot of communities split across that border. Normally they're playing football and netball against each other and crossing the border for work and school and medical attention. There's been a couple of cases come to light lately, in particular 2-year-old Mabel Dyer at Conniva in Western Victoria, needing to get across the border for medical help. Are you able to sort these individual cases out? Are you helping people get around these difficulties?
Yeah, I think there has been a bit of confusion early on in the process when people thought that when we suspended the cross-border exemption that we were suspending other exemptions. That wasn't the case. Since we've introduced border controls at the end of March, we've always allowed exemptions for people needing medical and health care. We've been in contact with the Dyer family and assured them that if they need to come to Adelaide for medical care, they'll receive the exemptions they need. We need to be clear that we're facing renewed challenges from Victoria, and no longer is this a bushfire, a COVID bushfire in Melbourne. We've now got significant active cases on the Western Victorian border. There are 8 active cases on the 3 local government areas on our eastern border, the Victorian western border. And only yesterday, Warrnambool, 160 kilometres from our border, had 4 new cases.
Yeah, so you're effectively trying to keep your state virus-free. How long are you planning to do that? If Victoria still had active cases in the community in a year's time, would you still have the border closed?
Let's be clear, the suspension of cross-border travel is in our view, a short-term measure. We're keen for Western Victoria to bring their cases down, and we're constantly reviewing that measure because we appreciate it is disruptive. We want to minimise the disruption. We wish Western Victoria all the best in bringing down their cases, and we're keen to restore normal operations on that border. Let's be clear, in the last week we've had 2,100 cases in Victoria, new cases. We've had 82 in New South Wales and only 10 in the rest of Australia. So even though we are just one border away from Victoria, we believe that our measures are necessary and important to keep the virus as low as possible in South Australia. Sure, we've had 3 cases this week. They were in hotel quarantine. We've demonstrated that we're very keen to move to COVID normal. That's demonstrated by the fact that our government is the first government in Australia, in partnership with the Commonwealth Government, to trial the return of international students. We're very keen to return our society and our economy to normal as soon as possible, but we'll do that within a safe public health framework. You
foreshadowed my next question. International students coming into South Australia, when and under what conditions?
This will be in the coming weeks. It'll be in the same conditions we have for other people returning. We've been receiving returning Australian citizens and residents for months now, since April.
So 2 weeks 2 weeks hotel quarantine, and then they're free to go to their studies?
That's right, full mandatory supervised isolation. This is an extremely important industry for South Australia. It's worth $2 billion a year to our economy. For every 4 students who come into South Australia, that's another South Australian who gets a job. It's an industry that competes with wine in terms of being our strongest export industry. So we're very keen to demonstrate that we can safely provide international education. These are people who are returning students. These are people who have invested time and money in their education through Australian institutions. We think it's only fair that they have the chance to come back and resume their studies.
I couldn't agree more. I know some people are opposed to it, but I couldn't agree more. As long as people go into mandatory and effective quarantine, anyone should be allowed to come to this country if they do that quarantine. The issue is, as long as they're not getting better treatment than Australians. So anyone in Australia who wants to go to South Australia can do so if they do that mandatory quarantine.
Well, let's clarify, for 4 jurisdictions, which is Western Australia, Northern Territory, Queensland and Tasmania, there is no restrictions on coming into South Australia. We still have 2 weeks self-isolation for people coming from New South Wales and the ACT, but for people returning from overseas, that will continue to be 2 weeks mandatory supervised
What about
isolation.
Victorians?
Well, Victorians is a different case in point. When you've got 2,100 cases in the last week. We'll continue to maintain our border with Victoria until it's safe to do so.
So Victorians are not allowed into South Australia, but overseas students are?
The reality is that these students are coming from relatively low risk, low prevalence COVID environments. Victoria is not that.
Victoria is that on a global scale. I think that's the issue that people will pick up on, that you've got stricter restrictions against Victorians than you have against international students.
As I said, there are 2,100 new cases in Victoria last week. There's
over 6 million people. What countries are your overseas students coming from?
Well, their port of dispatch is Singapore, but we are managing this within our.
But what countries are they coming from? What country are you suggesting that they're coming from? Countries that we have less to worry about when it comes to coronavirus than Victoria?
Well, we are doing mandatory supervised isolation for every single student that comes into South Australia. That's not possible for the thousands of people who are coming across the border from Victoria.
So Victorians bumped down the queue, international students ahead of them.
This is in relation to the cross-border movements. We're hoping this will be a short-term measure. In relation to the state borders, we are not going to have border controls in place for a day longer than they need to be. Neither do we want to hibernate our economy.
Do you know, Minister? Do you know how many active cases there are in Singapore at the moment?
No, I don't. But these
there are 3,500. Singapore would be about the same size as Melbourne.
Well, with all due respect, Melbourne's got 17,000 active cases.
No, it hasn't. There are 7,500 in the whole country.
The reality is that we've got mandatory supervised isolation for incoming international students.
But not for Victorians.
But we believe it's an important measure to strengthen our economy.
Thanks for joining us, Stephen White. I appreciate it.